Hi. Hello. So, thank you everyone for joining in. We're just going to wait a few minutes. For everyone to come on. My name is Dr. Diastasis. I'm the founder of the Eddie and Amy company. And basically what we do is support moms through breastfeeding and life after having a baby with health education and postpartum care kits. If you can hear me clearly, could you give me a thumbs up, please? So today we're going to be discussing one of the reasons why you may still look pregnant after 1 year after having your baby. There are several reasons, but this is just one of them. Yeah, and we're going to be having, okay, fantastic. We're going to be having the founder of Love and Grace and Kuva. Her name is Wande. She's going to come and talk to us about it. So just waiting for her to come online. I'll just take that off. And just wait for her to come online. I think I should send this to her. Okay. I'll just send through a message to her. So please, if you have any questions for us, please type that in there's a stack of cards with a question mark on top of it at the bottom of your screen. Type in your questions if you have any questions for us, and then we'll take that. We'll take the questions. The reason why that question box is so cool is everyone gets to see it as a banner at the bottom of the screen. Hello. Hi.
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 How are you? Can you hear me fine?
Not really. The screen is freezing.
I can hear you okay.
Okay. Can you see me?
Yeah.
Okay. All right. I think we'll just work with that then. Maybe it's coming from my end. Yeah. So, welcome. Thank you for accepting the invitation to come and talk to us about
Of course.
Diastasis Recti. Could you tell us a
Yes.
little bit about yourself, please?
Okay. Number one, I'm shy. I'm just kidding. Okay. Okay, so my name is Wande and I am the face behind Love and Grace, a motherhood platform for wellness in moms to be. I create e-courses and programs online for prenatal, postnatal moms who are looking to, get that overall sense of wellness in nutrition, in fitness, and even in your mental health. That's about it, I guess.
Okay. Okay. So, yeah. Could you tell us a bit about your background with postpartum, the core training and all that you do on your page?
Sorry, Ajay, I think it was breaking.
Okay, it's clearer now. It's clear now. So
Okay.
I wanted you to tell our viewers a little bit about the core training that you do on your page, for moms
Okay.
who've had babies.
So, okay. So the focus, as it relates to fit for love and grace, really targets postpartum moms. You're in recovery, either 6 weeks and above, and you're really just trying to get back into, being fit again, or not even fit necessarily, but just being well. Get back your mental state of, okay, I know this is my new normal now, but how do I adjust? Um, Health wise, fitness, wellness in general. Uh, I created courses that are targeted to really help moms who are struggling with either lower back pain, just recovering, pelvic floor pain. Is a bunch of things that you're still trying to recover or understand as you become a new mom. So my page really targets those issues and help moms address them accordingly.
So do you help moms who have issues with sort of like leaking urine after they've had their babies, because of pelvic
Yeah.
floor damage?
Yes, well, usually what I start with is an assessment. So we want to make sure that we know, where you're coming from, what your journey was like. Did you have complications during childbirth? Did you have complications during pregnancy? We want to start from there, from your foundation, and then gradually work up to where. So what you might need might be different from what another person might need. So just because you have urinary leaks doesn't necessarily mean that, what I think it is might be it. Doctor, have you had a past, those things have to be addressed first before you just delve into any program or any course. So that's one thing I always start with: assessment. I don't take on anyone without taking an assessment first.
Okay. Okay. Awesome. So could you tell, okay, the elephant in the room, while we are here, could you just take us through what exactly diastasis recti is?
Okay, so in summary, diastasis recti is the splitting of the abdominal wall. So we all have our trauma area here, and after pregnancy, or even during pregnancy, there is so much pressure pushed against your abdominal walls, causing your abdominal walls to split open. And in the middle of that split is not just skin, it's a connective tissue. And that connective tissue is called the linea alba. The linea alba, as your hormones change, pregnancy, and there's so much going on, the linea alba begins to naturally stretch, and that opening causes the separation in the abdominal walls. So that, in summary, is pretty much what diastasis recti is: the splitting of the abdominal walls.
Okay. So just for the I like to really really like distill things down, because sometimes we think that people follow, some of these technical terms, but so the linear bar is actually not muscle, is a sheet of like torso, right? Torso.
Right. So it's
Yeah.
it's almost like, how do I think torso might be a good example.
Okay.
So it's like a thin layer of sheets.
But
It's
it's
like
not
it's not
muscle.
muscle. Right, it's not muscle. It's made up of collagen and elastin fiber.
Okay.
So yeah, so it's a sheet that's, how do I explain? So I think torso is actually a good
Yeah.
example.
Yeah.
So it's a
Joins muscle
sheet that,
together.
yeah, joins muscles together and holds them together. So if it's almost like you're pushing against an elastic. I have an elastic band here. So it's like you're pushing against an elastic wall. So imagine this is your connective tissue, and then baby was here pushing against
That.
the
Okay.
abdominal
Okay.
wall. So you imagine that, right? So it's made up of collagen and elastin fiber that stretches out as far as it can go for up to when your pregnancy is over.
Mm-hmm.
And then some people still have that bulge after you've had a baby.
Okay. And then
You know,
who exactly? Okay, sorry. I'll let you continue.
go ahead.
Who
So I think I
say
was
what you
done.
want? Okay. Does this happen to everybody? Who is at risk? Who are the people who are more likely to come down with this bulging?
So So the people that are most likely that fall in the risk factor category are moms that maybe they had heavy children at birth, maybe they had twins or they had babies who were heavy, or they've had two or more children. Usually, also if they are above age 35, they tend to have not as strong of mm, that age bracket
Yeah.
as you go over the age of 35. Your body
Yeah.
is not as compared to when you were younger. So,
Yeah.
maybe your pelvic floor or anyone in general who doesn't really have a solid or firm pelvic floor foundation,
Owned.
that could actually, yes, of getting diastasis recti.
Okay. Okay. So, and I mean, is there anything that can be done to sort of prevent it from happening?
Yeah, so the major cause of diastasis recti is usually confused by pregnancy. People think because you are pregnant, that's the end. So I was pregnant and I have diastasis
Okay.
recti. The reason for diastasis recti is the pressure in your space. So imagine this small vacuum here in your trunk,
Mm-hmm.
and you're holding in that area, and baby has nowhere else to go but to only push against your abdominal wall. So if you have a tank filled with a balloon, and the balloon sits in that tank, completely in that tank, the balloon is taking up almost all the space. The volume of that is taking up almost everything in the space. So the pressure is higher compared to if you just drop a needle in an empty tank
Mm-hmm.
where there's less pressure, you know. So that's the major difference between high AIP, which is abdominal pressure, and low AIP, lower intra-abdominal pressure. So to prevent that, there are certain things that you can do. Maybe to use the word to mitigate or to manage it, because more than likely diastasis recti happens in about 60 to 70% of women if it's your first or second or third time having a child. So a prevention, we should really use the word maybe more of like maybe managing this situation, because everybody has some level of abdominal wall separation, whether it's one gap, whether it's half gap, there is still some form of a separation because you're carrying a child, because AIP is high there. There's a lot of fighting for room and fighting for the space. You know, everyone is fighting to really get in there. And mom is also experiencing the overall burden. So ways to, mitigate that might be to manage how you maybe are standing or
So
sitting,
that's your posture.
puts less your posture should be you try to make sure that your posture is always in check. It's kind of sometimes not as realistic to constantly check your posture, but
It's a
if you are
practice.
intentional about, yes, the practice, exactly, it will become second nature throughout your duration of pregnancy. So, maintaining good posture, making sure you're not lifting anything too heavy because you're already carrying the weight of baby. Imagine that weighing you down already. And there are simple core exercises that you can do at home, anywhere in your house. You could even be in the shower, you could be cooking, really engaging your intra-abdominal, your
Muscle.
abdominal wall muscle,
Mm-hmm.
core, waking them up, telling them what to do, and they act accordingly. Because one thing I would like to mention is there's no way you can tell your body what to do if your brain doesn't tell you what. So if you want to engage your core, you can't just say core get engaged. You have to be mentally tell your brain, okay, I'm doing this, and it's engaging. So intentional steps like that can help you manage, and I guess use the word prevent, but not completely, because everybody has some level of separation.
Okay. Yeah. So since you were talking about intra-abdominal pressure, I know like for moms who've had cesarean sections, are they at higher risk of having the diastasis recti?
So moms who have give birth vaginally, so the what we should really look at, we should back up.
Okay.
So if you've had um if you are pregnant and you're not even sure how you deliver your baby, maybe you deliver a baby vaginally or you deliver a baby C-section. The I don't want to say cocoa of the matter, but the cocoa of the matter is that you were pregnant,
Yeah,
right?
yeah,
So we were both regardless.
yeah.
Now, when it comes to delivery, that's a whole different story. And you're a doctor, so you will know more than me. When it comes to delivery, it's a whole different story. But because for C-sections, there are different steps to take for C-sections. You first of all cut through the subcutaneous fat, then you go into the rectus fascia, then you go into the rectus
Mm-hmm.
abdominis, and then you go into different layers, perineum, all those layers. You at some point actually touch the rectus abdominis, which is your six-pack
Yeah.
muscle that actually engages in the splits.
Mm-hmm.
So even though during the cutting by the doctor there's a touch there, they don't actually touch your
That's
rectus
that's
abdominis
if
muscle
you're
and
doing
tear
a
it open.
bikini. That's if you're having a bikini cut. I mean, which is what's very
Right.
popular
So
now. Yeah.
exactly. So it depends on what kind of cut you're having. But women who, if you've always had a strong core, if you engage in the examples I gave earlier, good core engagement, good body alignment, good posture, those things all play a huge factor in who is susceptible to having it, whether you gave birth vaginally or via C-section.
Okay. So there is something something I was going to ask you, which I forgot. Is it only found in women?
No, so diastasis recti is common in women because you've had baby. It's very obvious that baby was there. Baby was a contributing factor. But children, newborn babies also experience some level of abdominal wall separation. But eventually, as they grow older, the muscles begin to come together. And also in men, if you hear the phrase, the popular phrase that says the beer belly.
Yeah,
So
go.
if you have a beer
Yeah.
belly, or yeah. So the subcutaneous fat on your abdominal wall pushes against the wall as well, opens the linea alba, and that stretches there. So you still have that split. So it's in women, it can found in children and also in men. So whenever I define diastasis recti, I like to say in women, not in general, because it affects different. It's not gender specific.
Okay.
Yeah.
Okay. So going back to the question I wanted to ask, because you said that there's a role of increased pressure in your tummy, in coming down with the diastasis recti, and moms usually, because of hormones and reduced absorption of increased absorption of reduced transit time in the gut, they end up being constipated a lot. So and I know in medicine, after a CS and all that, they try as much as possible not to let you have prevent you from having constipation, because of the pressure on the wound and all that. So people who have chronic constipation, maybe as a result of hemorrhoids or have chronic cough, are they at risk of coming down with diastasis recti? Sorry for the long question. Long question. I'm gonna come to the point.
Sorry, I'm so sorry. Actually, I didn't get the
You
question
didn't get.
because it was
Okay.
breaking.
Okay, good. Let me just shorten it now. Since pregnant women are prone to having constipation, right? Does that also increase the risk of coming down with diastasis recti? Prone to having constipation and straining when they have to poo, are they at risk? Did you get that?
Mm-hmm.
Oh wow. Okay.
So
Can
I
you
heard
hear me now?
straining when they need to poop. Are they at risk? Who is straining?
Yes, yes.
Yeah,
So
yeah, I can hear
pregnant
you now.
women, they're prone to getting constipated during pregnancy, right? Because of a host of things,
Right.
the hormones
Mm-hmm.
and things like that. So are they all? Does the constipation also put them at risk because of the straining when they have to
Yeah.
poop?
So
Yeah.
when they ask, so I guess I'll take that question more of as it relates to the pelvic floor, because since the straining and the pooping and the hemorrhoids and the straining, all those things happen at the bottom, at the base of your core. Um, those are almost like inevitable factors. So it's almost like human nature. When you need to poop, you poop. If you need to strain, you strain. they affect more of the pelvic floor muscles than actually, you know, making you prone to diastasis recti.
Okay.
If that makes sense.
Okay.
So that targets more of the, so that also depends. Do you have a weak pelvic floor? A weak pelvic floor. So a weak pelvic floor came as a result of diastasis. So that's a symptom of diastasis recti. Then almost like a contributing factor of a symptom. So you have diastasis recti, and then a sign that you might have is might be a weak pelvic floor, and then the straining that you talk that attach to the weak pelvic floor.
Okay, so that means that, I mean, for you to have, just reiterating what you're saying, for you to be predisposed to diastasis recti, you're most likely going to be predisposed to having a weak pelvic floor as well. Did you hear what I said? Did you hear what I said?
Right.
Yes. Okay. All right.
Correct. Yes.
Okay. All right. So now can we go through like the effects? Why should anybody care if they have diastasis recti? Why should they care? Why should they be bothered? You know. Okay, this is just a preamble to what are the effects of diastasis recti.
Yeah. Okay, you should care because you are not, imagine if you know that you can operate at 98% efficiency and you're only operating at 50% efficiency. Would you be bothered that you have a gap of almost 40%? Would you care as a human being?
Of course. 40 is almost 50.
Exactly. 40 is almost 50%.
Yeah.
So you're like, if I can operate at almost twice of what I'm operating at now, why wouldn't I be bothered? Why wouldn't I want to make a change? So definitely anyone who thinks they have diastasis recti or knows that they have diastasis recti should not accept it as it's one of the things of life. I had a child and things just happened and I'm just stuck with diastasis recti. Please remove that thought from your head. Change your mindset. It is absolutely not acceptable to accept your normal as normal, because you can always operate at a higher level. You can always have a stronger core. You can fix your posture. You can strengthen your pelvic floor muscles. There's so many things you can do even without surgery. I always advise against surgery at all costs. You can always a man-made problem with a natural solution before going into something else. So always try the natural solution first. So definitely anyone who has diastasis recti can
Specifically, I mean, apart from,
definitely
okay, sorry. Please finish.
go ahead.
No, you were saying something mid sentence.
No, so I was saying, yeah, so definitely if you believe you have diastasis recti or have diastasis recti, you definitely want to, seek the right help in getting what you need to perform optimally.
But how, apart from a bulging tummy, yeah, which is, cause I mean, to be honest, it's actually a cosmetic consideration, right? What are the things? What are the effects of diastasis recti on a person's quality of life? What are the things that you notice? What are the things that will go wrong, in your personal health?
So diastasis recti can lead to a number of things. You can have, first of all, we've mentioned a few times, weak pelvic floor.
Okay.
So your pelvic floor consists of so many muscles that do a lot of things. Your pelvic floor is the real MVP. Your pelvic floor is the gateway to your vagina, to your bladder, to your rectum. So imagine if your pelvic floor is weak. So you just see this as the pelvic floor, and then this is your trunk. So this is your stomach, your breast, your everything, and this is your pelvic floor. The pelvic floor serves as the foundation of your core. So imagine if you don't have a strong pelvic floor. Just imagine what everything else here is going through. Your posture is off, which gives you lower back pain. You might have, because your pelvic floor muscles are not tight, the sphincter that is there, the open and shut valve that is there, is weak. So then you have random leaks. Maybe you have.
I'm going to stop you when I think you're going to technical. So a sphincter is the
Oh,
thing
sorry.
that prevents you from leaking urine or leaking poo. Those are the valves that
Right.
prevent moms from leaking urine. Yeah, the muscles around those openings. Yes. Okay, so please continue. Yeah.
Thank you, doctor, for helping me when I'm getting,
Yeah.
yeah. So yeah, dispenser has valve openings in your vagina, in your bladder, and your rectum.
Yeah.
So the pelvic floor pretty much holds everything together. Ever since I started learning and did my certification in pelvic floor training and all that, I was really, really amazed by how much, like, I didn't even know about what the pelvic floor does. I think it's the most important
Group
part of
of
your
muscles
body
in your
because
body.
yes, it holds everything together. It's really your foundation. So if your foundation is weak, imagine what everything else here is doing. It's all floppy. You experience different types of incontinence. There is stress incontinence where, maybe when you cough or you laugh or you sneeze, then you pee in your
Yeah.
pants. There is overflow where you can't completely empty out your bladder when you pee. There's still some little drops. There is what other incontinence. There's the urge continence. Oh, I need to go now. I
And
need
it's
to
already
go now. Like
coming
right
out.
now. Right, it starts to drop out. And there's also functional incontinence. There is you can't get to the bathroom on time and then you pee in your pants. So there's so many things that having diastasis recti can do to you. So we talked about incontinence, talked about weak pelvic floor, talked about and then lower back pain. So again, your pelvic floor is the foundation of your core. This is your whole pelvic floor. Your trunk area, your core is here, and this is your back. So imagine having your
Stable.
lower back pain. Where does the lower back from? Right, because your pelvic floor is not
Mm-hmm.
strong. It was stronger than pregnancy. Clearly, you had a child. Of course, things
Mm-hmm.
happened. Intra-abdominal pressure increased and so on and so forth. And it affects your back. It affects your lower back. It affects your shoulders. It affects your hips. It also affects even depending on the kind of shoes you are wearing, how you are sitting. All those things play a major role in having, diastasis recti because you have a weak pelvic floor, so on and so forth. So there is a family of what's it called? It's almost like a domino effect.
Yeah.
When something here, everything else is
Unstable.
disrupted.
So I mean, apart from the pain, am I correct to say that if you're having things like leaks, it's also a social issue? I mean, you need to let's say you're out of the house and you need to, you're pressed or something, that you might actually pee yourself, and then obviously that's not cool. I mean, people who have fistulas and all that, they have issues like
Right.
smells and all that. And then there's another thing I was thinking about. Is it um the I mean, if that means that you'd most likely have to go around with liners, because of that issue.
Yeah. Right. So the thing is, I'm not trying to so the thing is, when you go around with your panty liners, you go around with maybe
Adult diaper.
what's it called? Or
Yeah.
adult diapers, exactly. So these are things that are fixing a symptom, right? But they're not treating the
Yeah.
cause. But you as a human being can go and actually get a cure for the cause instead of patching it up and fixing just the
Yeah.
symptoms. Oh, I had a baby. Let me just wear the adult diaper. I'll be fine. It will take me 2 hours to go and come. So by then my pad should be
Yeah.
full. Our mindset should, as to more like I have urinary incontinence. I know I have it due to diastasis
Mm-hmm.
recti. Urinary incontinence is a symptom of diastasis recti. Fine, I need to fix it. Let me get to the root cause. Let me find out. Let me shut off what is causing me to do this. Versus, let me go and buy pad. Spending money on pad when you can actually sit down, assess yourself, figure out exactly what's going on, and fix the root
And get a
cause. So we
sustainable
want to not
solution.
exactly get a sustainable long-term solution. We don't want to be doing short-term fixes and quick fixes here and there. We want to have long-lasting solutions that give you happiness, give you an optimal life, in
Okay.
essence.
Awesome. Thank you so much. I was going to find out. So now, how do you differentiate between? Okay, so we've had people who've had, like, they've had a surgery, and then because the surgery is cutting into, maybe not muscle, but all those connecting tissues, all those torsos in the body, and so you've already made a
Yes.
defect in that. what is the difference between a hernia, which is a bulge out of a wall that already has an issue, and that diastasis recti? What's the difference?
Okay, so the hernia is pretty much an organ in your body that's bulging out. That's pretty much the summary. And diastasis recti is caused because there was excessive pressure in your abdominal trunk pushing against the abdominal wall to cause the bulge. So you see both bulges, but you want to not confuse them. There's a difference between a bulge that was caused by intra-abdominal pressure pushing against the abdominal wall, and there's a difference between a bulge that is caused by an organ that's pushing out of your abdominal wall. I'll give you an example of something called pelvic organ prolapse.
Okay.
Pelvic organ prolapse, known as POP, is when your pelvic floor, again, like I said, you have your bladder in front, you have your vagina in the middle, and you have your rectum at the back, right? And this is your pelvic floor. So pelvic organ prolapse happens when one of these organs is pushed out or in because you maybe experienced childbirth or maybe even had injury down there in your pelvic floor. So there's something called rectocele and cystocele. Rectocele is when your rectum is pushing against your,
Vaginal wall.
yes, the back of a
Yeah.
vagina, and cystocele is when
Bladder.
your bladder against your vagina. So that vagina has nowhere else to go but up. It's like, oops, it's like you're being squished. You have two things squishing you, and you have nowhere to go but you go up. So that's also a bulge, right? The bulge, maybe in the bladder has a bulge, rectum has a bulge, but you want to always differentiate the bulges between organs and the bulges between diastasis recti. Those are two completely different things and should be handled carefully and differently.
Okay. So how do we find out if you have, is this something you can find out at home? Is this something you need to go to a hospital to check out? How do you diagnose it? How do you
Yes.
find out?
You can test, a self-test at home. I always careful using the word diagnosis because only a medical doctor like yourself can actually diagnose diseases and stuff. I'm not a medical doctor. I'm a pre-postnatal fitness specialist. While you are a medical doctor, medical doctors diagnose and they give treatments. Specialists will tell you you may have this because you've done like a self-test. So there's a self-test that you can do at home. I have guides on my page, and also a video I've shared as well. You can do test by laying on your back, your knees bent, and maybe taking two fingers at first, raising your head just an inch above the ground, and then putting that right above your belly button and also below your belly button. If you have two or more finger with gaps in between, you may have a mild to severe, a moderate to severe, sorry, mild to moderate to severe case of diastasis recti. Depend on how many can. So it's all about that. So if you have more than two fingers, then you definitely have diastasis recti, and it might be mild, moderate. But if you have like three or four, that might be severe and it needs immediate attention. Because again, having diastasis recti doesn't come by itself. It's not about just the bulge. It affects other things that we can't see, and that's what scares me the most because we go around. Our bodies are so resilient. We go around that we don't even know what's happening in the body, but things are not right. So having diastasis recti, getting a self-test at home or checking with your doctor and knowing the next step to do is extremely important. Please do not take your bodies lightly. Your bodies are all you have. So treat them with care, love them, nurture them. You rely on your body, your children rely on your body, your partner or your spouse relies on your body, and most importantly, you just need to take care of your body. It's the only body you have. They always say your health is your wealth. Take care of it. It's extremely, I can't overemphasize the importance of looking after yourself, especially after childbirth.
So either a doctor or can a physiotherapist help with finding out if you have that? Okay.
Definitely, a physiotherapist can check, a pelvic floor specialist can check well if you have diastasis recti.
Okay. So I'm going to share what actually Wande has a video which demonstrates how you can check at home. So I'm going to share that in my stories. For some reason I'm not able to I thought I was going to be able to show it during the life, but it's not showing on the carousel here. So I guess I'll just let it go. Yeah. So and then how long do we have to work on ourselves to sort of try and reverse the damage that has been done? How long does the treatment for diastasis recti take?
So I wouldn't like put an end date to a treatment of diastasis recti. It's more like an ongoing recovery process. So one thing I know that programs, you may find programs online that say 4-week program, 6-week program, 10-week program. They are giving you a of time that you can at least see a noticeable difference. Not that you're cleared, one thing I like to emphasize to my clients is that it's extremely, extremely important that just because you have this program to take, you don't just stop there. You have to continue, and then it's almost like you're helping your child walk for the first time. So once they're able to now walk and figure out on their own, then they're able to, engage and do other things and run around. But you were helping them when they were crawling, when they need that help in the beginning. So most programs, I intentionally created a foundation course program first, which is absolutely free. And then you go into the actual diastasis recti program where you take it for 4 weeks and then begin to see changes over the week periods. But it doesn't stop at the 4 week when you are done with the program. You can continue, you can repeat it before you progress into the next course available as well. Or just in general, you just start to adapt healthier, more intentional habits. How am I sitting? Is my posture good? Am I sitting okay? Is my lower back position properly? Am I picking up objects correctly? Am I bending in ways that can affect my pelvic floor stance? Like, what am I doing? Am I intentional about how I'm taking care of my body? Little habits here and there go a long way in the overall picture. And one of the goals of Love and Grace is really to provide that holistic wellness approach. It's not a quick fix. Okay, there. You lose weight, blah, blah, blah. No, it's a continual, gradual process that success for me is when someone says, wow, the program ended 8 weeks ago and I'm still feeling as stronger, like I'm feeling stronger than ever. That is success. That's what success says. Not, okay, the program is on, what's next? No, it's a lifestyle. Continue, change your mindset, correct your friend. Oh, my darling, sit up straight. Oh, you don't have to they pee your pants and think it's normal. You can do that. So your mindset starts to change and then it's inadvertently starts to affect the way you see
Yeah.
wellness
Okay.
as a
So I know on your page you have some illustrations of bad posture, and how and then you have, okay, you've not yet put up that the how to check here. That's recti test yet. You
yeah,
haven't. Okay. So
yeah,
you're going to have that on your page, and then I'll put it up in my stories as well, on my page as well. Yeah.
okay.
And then so please just to quickly recap for our viewers, what are the things that they notice in themselves that they need to that should prompt them to check for diastasis recti?
Okay, so we talked about urinary incontinence, and there are different kinds of incontinence. Different, maybe you have the urge to pee, maybe you laugh or you
And the
sneeze, and
leaks.
then
Mm-hmm.
or maybe you use the toilet, you thought you emptied your bladder, but you're still kind of leaking as you go. Lower back pain is a common issue as well that if you have lower back pain constantly, any I want to mention that anyone that's experiencing lower back pain for more than 12 weeks, you really see a physiotherapist or physical therapist, right? It shouldn't last. Anything like that lasts more than 3 months is a
Mm-hmm.
problem. You should really see a specialist right away. So urinary incontinence, lower back pain. If your posture is off, you sometimes you notice when you're standing, even when you're carrying baby, because the weight of baby is on your chest, you tend to like slouch or you tend to punch forward. So you want to be more conscious of how you're standing, making sure that your elbows and your aligned, your hips and your ankles are aligned. So those things, it's unrealistic to always catch yourself, but when you can catch yourself, just
Second
try as much
nature.
as on nature, exactly. So you um what
Then
else?
obviously the bulge.
Pelvic floor, yeah, Exactly, the obvious pooch. Exactly. Maybe you've had a pooch, and I don't want you to get worried. Oh, my pooch hasn't gone after 6 weeks. It's just been 6 weeks. You can calm down. Maybe like if you wait and see 12 weeks, 13 weeks, 15 weeks. If you notice that 6 months you are still having a bulge that has just refused to go away, then you are probably in the DR category. A bulge that just refused to go away, or like we said, lower back pain, urinary incontinence, a bulge, any pelvic floor pain area that's just there, as well.
Okay. And then after and then the therapy involves exercises.
Right. The quick no, I shouldn't say quick, but um the
For
managing.
mild cases, mild and
Okay, I
moderate.
should say exercise.
Mhm.
Mild to moderate cases, even to severe cases, you really want to engage in your core exercises. And I actually have not mentioned the most important parts of your core muscle, which is your transverse abdominis muscles. The transverse abdominis muscles sits right after the rectus abdominis. So your rectus abdominis muscles are your six packs, right? Your six packs muscles are what you see. Wow, she has six packs. That's so nice. But guess who does the real work?
The
The
ones that
transverse abdominis muscles that sit right, that they actually cause that stomach to be flat, so they stretch it out for you, they straighten it out. So your transverse abdominal muscles give you that flat sheet that you need, but your rectus abdominis muscles is in front, kind of showing you and saying, oh, I have six packs, but the real work is done by the transverse abdominal. So you really want to engage and recruit those muscles as often as possible when you are doing any program, um or even when you're engaging in core breathing. Core breathing is we can even do an IG live, a quick one on core breathing and how to engage your muscles properly. You also want to stay away from exercises that are not diastasis recti encouraged. There is no industry standard that says only these should be diastasis recti exercises. However, there are some that can put extra strain on your lower back. They can put extra strain on your abdominal area, which is still recovering. Some people, I heard someone tell me that they were not seeing any results because she had diastasis recti, but she was engaging in HIIT cardio. I'm like, you can't
cardio.
do that. You need to start and then gradually get to a point where you can venture into cardio and do other things. But doing the correct exercises are extremely important in your healing
Okay.
as well.
So please, ladies, it's very, very important that the sort of exercises that you're doing to try and even if you're just trying to lose weight after a baby, it's very, very
Yeah.
important that you're careful about the sort of exercises that you're doing so that you don't hurt yourself and you don't make things worse, especially if you have diastasis recti. So someone is asking, are there any recommendations as to how to get the tummy down or flat aside from waist trainers and a tummy belt?
Okay, so I'll be quick because I know the thing will soon go off. Recommendations for okay. So again, I don't know if you joined earlier, but I want you to change your mindset of I'm looking for a flat belly, because this is a flat surface. Nobody's belly is this flat, first of all. So you first of all want to make sure that you know what's happening there. You have diastasis recti. If you do, okay, fine. Now you've tested. Now let's engage in your core breathing. From core breathing, you go into diastasis recti exercises. Waist trainers and trimmers will help you maybe hold your abdominal wall
Support
together, but the
your
right, but the actual work is done by you. Do you
yeah.
understand what I'm saying? You have to really engage the core. If you don't engage it, it just means you're adding an additional extra clothing to your body. Nothing will really, you won't see. You might have a waist trainer that might be nice on your waist. Oh wow, it looks so pretty, it's so cool. You remove the next minute and your body goes back to the way it was, because your waist trainer was relying on, right, your body was relying on that waist trainer to hold it together, but once it's off, it's gone.
Yeah.
So the onus is us to do the work and engage the deep inner
And
core muscles
tone those
to hold
muscles up. Tone those muscles up.
on the
Yes,
muscles.
yes. So I mean, and then other little things like, I mean, if it is actually fat in your tummy that's making your tummy good, that's making your tummy bulge, then you need to work on your diet and exercising.
Diet
Yeah.
that thing.
not eating
Right.
late after
And I
night
just
when your metabolism has slowed down and stuff like that. So I mean,
little right.
yeah. So I mean for what's it called, for people when they've had surgeries, especially abdominal surgeries, there's actually a medical grade um abdominal bind that they can wear. It's supposed to help them with breathing, deep breathing, because sometimes with pain, people tend to sort of hold their breath and they don't breathe properly. These things can cause complications later on. It helps to also support their backs, but it does not tone your back. It is the toning of your muscles that help you with your tummy get flat. The toning of your muscles that help your tummy get flat. So what those I don't want to call them wish, what the binders, abdominal binders, are supposed to do is to help to support you right after the procedure, right after childbirth. But they will not make you have a flat tummy. you know they just give you that support so that you can breathe well without pain, you can move around easily, and then they can support your back. Yes, please. This question, I remembered it like 3 times, and I keep on forgetting to ask you. A lot of moms have some people feel the reason why they don't want to have an epidural is because after the last epidural they had back pain. You know, I know we've talked about it before, but can you speak to that, please?
Sorry, say that again. Sorry, someone
Epidural
asked a
do
question. I repeat the
epidurals
question.
do epidurals cause back pain?
Mm-hmm. Okay, so what about that?
No, so I was saying it's something that I think we need to address. It's something that we need to address, as
Okay.
in, yeah.
So I haven't actually experienced, well, I had epidural, but I haven't really heard people that had back pain after epidural.
Mhm.
But because the focus here is on diastasis recti, if you did have diastasis recti, maybe after you had your child and you did have epidural, we can't really tell what is causing the back pain. But for sure, we know that lower back pain is also associated with diastasis recti,
Yeah.
period. For now, on the epidural side, I'm not a medical doctor, so maybe you might have more um knowledge on how that's affecting back pain, but
Okay.
I'm not going to speak.
Yeah. Okay. So the thing with epidurals is the complications of epidurals include things like having a headache, which they call a spinal headache, or maybe your blood pressure crashing during the procedure. That's a complication. They might traumatize something around that area, and then you can have bleeding and all those things, or maybe an infection of the area where the injection was made to put the painkiller in. But epidurals do not cause, as in they're not known to cause back pain. So the reason why I'm trying to link it to this is that I've actually heard people say that when they had an epidural, oh, that they now start having back pain, a few years later, and they try and attribute it to the fact that they had an epidural.
Actually,
In my life, I
that's
have
how
had
I've
5 epidurals. Like, I mean, for a procedure I did, and then for the 2 births I had and everything. And it is not I don't have back pain. So it's not. So
right.
what I wanted to say is that sometimes the back pain that we have is as a result of errors in posture, as a result of a cord that is not engaged, or as a result of maybe the diastasis recti that you have, like there's a bulge and everything is so your cord, that the muscles are keeping you upright and all that. So if some of them are weak and some of them are strong and counteracting, and just pulling everything in the direction of the ones that are stronger, you will have back pain. So I just wanted to address that. Yeah.
Thank you, Dr. I wanted you to speak to that because I associated epidural and back pain before.
Yeah.
I know that you can have it as a result of type, but not as a result of
Yeah,
epidural.
because the reason I wanted to mention it because I've heard it being mentioned before. Someone tries to attribute it to, um, I mean, not
No,
not that study shouldn't be done, but so far, epidurals don't cause back pain. So please, if you have any more questions, could you share them with us? So what we wanted to also announce is that we're planning to have a webinar in future. That has to do with core strength training and treatment of diastasis recti and mental health for moms after they've had their babies. So we'll put up details about that much later on. And we're going to put up the video of how to test for diastasis recti. One is going to put it, we're going to do a post on it, and then I'll also put it in the stories. So yeah, I think we're done. Yeah, we're done.
Okay.
Okay, thank you so much for your time. Thank you for
Thanks
all
for
that you
having me.
do. Yeah. All right. Thank you so
Yeah.
much, everyone. Thanks for joining. Bye.
Bye.